Okay, so this case, I think we've talked a little bit about this. We heard from Dr. Coppell this morning about this relationship between congenital heart disease and genetic abnormalities, and we're starting to learn a lot more that many of our patients actually do have genetic conditions that are being picked up on more detailed genetic testing. So I have two cases to present, both sort of showing similar things. All right, so case one is a 38-year-old, first pregnancy, was an IVF pregnancy. She did not have first trimester screening, including NT measurement was not done. She was traveling and didn't have it done. She came in for her ultrasound at 20 weeks, which was normal, but she did opt for an amniocentesis at that time because of maternal age, and also her second trimester screening suggests high risk for trisomy 21. They did do a microarray at that time, which was normal. And then she showed up at around 30 weeks. I think they were monitoring the baby's growth for unclear reasons. And at 30 weeks, there was new onset hydrops. So here's what we saw at 30 weeks. You can see there that the heart 4-chamber view looks pretty normal. And there's these large bilateral pleural effusions. You can see those there. Heart function looks pretty normal. And there really wasn't fluid anywhere else. It was really the bilateral pleural effusions. There was some polyhydramnios, so that's why it was called hydrops, but it was primarily these large bilateral pleural effusions. And so they asked us to do a fetal echo. This is our scan, just to make sure that there wasn't any structural heart disease. That's part of the evaluation of fetal hydrops. And overall, the structure of the heart looked pretty normal. And when we took a close look at the pulmonary valve, we thought, well, maybe the pulmonary valve looks a little thick, doesn't look entirely normal. We put color over the pulmonary valve, and it looked like maybe there was some trivial acceleration of flow across the pulmonary valve. So what do you guys think? What do you think we were thinking and what we were concerned about? New hydrops, maybe a dysplastic pulmonary valve. Any ideas about a potential genetic condition that can cause that? I heard it. Noonan's. Great. So we were concerned about Noonan's, and she had had this amniocentesis at around 20 weeks, so there was some sample left behind. So we recommended an exome, and what we found was a mutation in the PTPN11 gene consistent with Noonan syndrome. So that was a really, it was a very sad case for this family because they had kind of gone through the whole screening in the second trimester. They really thought, everything was fine, everything was normal, and then they get this diagnosis at 30 weeks gestation. Okay, so case 2. This is another patient that came to us recently. Also, we didn't really know what her first trimester screening was. I think it was normal, including the nuchal translucency, but we didn't really have that measurement. She had an ultrasound at 20 weeks, her normal sort of anatomy ultrasound, and the obstetrician thought the ventricles looked thick, and so they were worried about hypertrophic cardiomyopathy. So they recommended an amniocentesis at that time at 20 weeks. She had a microarray that was done, which was normal. And then she was referred for a fetal echo. And so here's what we saw. So here are the chambers, and they do look a little thick. You can see here both ventricles are on the thicker side. Qualitatively, systolic function looks pretty normal. And then we looked at the rest of the anatomy of the heart. The rest of the structural anatomy looked normal. We thought maybe the pulmonary valve, again, this was pretty subtle, looked perhaps a little dysplastic, but it wasn't as obvious as the previous case that I showed.